nursing case study, presented to you by Group 3, entitled Multiple Injuries Secondary to Vehicular Accident. Objectives. After 2 hours of nursing case presentation, the student nurses will be able to determine the definition of fracture, discuss appropriate preventive measures and nursing management for a patient with multiple fractures, and identify different types of treatment and procedures needed for a patient with multiple fractures. A fracture is a break in the continuity of a bone and is defined according to its type and extent. Body organs may be injured by the force that causes the fracture or by the fracture fragments.
Wala ang kinikilingan, wala ang pinoprotektahan. Serbisyong totoo lamang. Ito ang 24 oras. Huling-huli ang motorsiklo at truck sa Camellia Homes, Bacolod City. Narito na po si Jill Ann Matulak para magatid ng news flash. Jill?
Kuhang-kuha ang biglaang pangaagaw ng linya ng motorsiklo na bumangga sa nakasalubong na truck. Sa lakas ng impact, tumilapon ang rider at nasagasaan ng kamay at paa ng biktima. 3 bali na buto ang natamo ng biktima na si Marco Rodriguez. Kausapin natin ang witness sa nangyaring aksidente.
Kita ko gid kaya grabe gid ang dalagan ka motorsiklo si Dasig balaga isisi pang agi. Do sa katikalon nga kita na gid dako ka truck masulod gid. Sala gid ka motor ya, sala gid ka motor. Nawa balaw.
Nasa ospital ngayon ang biktima. Sa kasamaang pala, di natin siya makakausap ng harap-harapan. Pero dahil mabait ang doktor at student nurse na nagbabantay sa biktima, pinayagan tayo na makausap siya virtually. Good morning, Sir Marco. Mamangkot lang ko tani sa imo background kag kung paano ni natabo sa imo.
Mayong aga guys plano. So, ngalan ko si Marco Rodriguez, 41 years old, Santiago City, kag-graduate sa civil engineering. Bali, amo ni natabo ko. Pupusyo ko bi magdali punay, tawhay mo ng dalan. Amo lang gito ya ang time nga may truck pala ha. Di amo to na nag-overtake ko sa truck. Tapos wala siya siguro, kakita sa ko na nag-overtake ko. Tapos nabungguan likod sa motor ko, tag amo to dayon na natumba ang motor ko. Tag natukod ang akon kamo, dayon napilpilan sang motor akong TL. Ay, arigali akong student nurse sa Lasal. Dahil lang gid ha, mamangkot niya sa history ko, makaulat nila siguro ang news flash na. Nurse, good morning.
Sir, good morning. What no? Ako gali si student nurse Carl. Mamangkot lang ko sir about sa imo ha, dasigon talang niya. So, saan mo gani ang last immunization, sir?
Para sa akong booster, mga last year of August, wala ko mo.
Nakaagin na ta sir surgery?
First time ko ni nurse.
Gadayat ka sir or may or bawal sa imo? Kag ano mga pagkaon nga hindi mo gusto?
Wala ko gadayot. Sus, kag wala man bawal sa akong kanon. Dayon, basta pagkaon, gakaon man ako.
Nang may problema tayo sir sa pagpamason, tapos may ma-observe ka man nga lines sa mga urine o kunin sa imong stool?
Daw wala man nurse. Okay lang gid. Okay lang gid. Sige monitor ko lang gyapon nurse.
Nang ga-exercise man ta sir?
Huwag hampang ko basketball, pampabalhas lang gid.
Nang ano date subong gani sir, kag oras, kag sino ko gani kung madumduman mo?
Date, siguro May 6, 9:38 AM. Kag ikaw si student nurse Carl?
Sakto sir. Nang alas an ka usually gatulog sir, kag kamusta man nimo tulog?
Mga 9 PM ko gatulog, tapos sa subong, utod-utod, tulog ko kay gulpi lang. Kag isaga sakit ang lawas, amo to gapabulit ko si lisod.
Tikay damo ta fracture sir, anong pamatsag mo?
Wala wa ay man ta mahimo kag sala ko man din. Pero bisan amo na ginasuportahan ang Japon sa asawa ko kag sa dira pa lang grateful na dito.
Sino gabantay kag gaobra para sa mga bata niya sa bong sir? Kaya hindi ka kaobra sa bong.
Ang sama ko kag ang mama yato ato to subong sa balay.
Kabalo ko medyo sensitive ni nga topics sir no, pero active pa man ka master sa mga sexual activities. Sige sir, noted. Balik sir, kung ma-stress ka maya sir, ano nahimo mo?
Stress ko kung wala, napangamoy ko ni Lord. Kay ginabuligan ko ni Lord sa mga naagdan ko sa una, kag thankful gid ko ni Lord na amo lang yung natabo sa akon.
Nang Roman Catholic ka, sir, no?
Honest ah.
Sige. Sige, sir, thank you, good, no? Nang tuwag ka lang kung may kinanglan ka pa.
Sige nurse, thank you nurse.
Uy, yun na.
Oh, yes, Doc. Nung bago lang ko talk po, nursing story sa patient. Ano na, Brahma, Doc?
Ario, watch.
So now we'll be discussing the assessment per system and their significant findings from day 1 to day 3. For our general appearance for day 1, patient is lying down with his injuries wrapped in elastic bandage. Patient has light brown skin, weighs 65 kilograms, and stands 5'7" tall. The patient is currently wearing the hospital gown. For day 2, patient is having a conversation with her wife while sitting and is currently wearing a new hospital gown. For day 3, patient's general appearance is sitting upright with his injuries already casted, and he is currently wearing the hospital gown with an arm sling. For our assessment in HEENT, for the head, there are no injuries found in the head. Eyes, eyelids show no discharges and discoloration. Pupils are black and equal in size. Iris is flat and round. For the ears, the patient was able to hear the ticking in both ears during the assessment of watch-tick test. For the nose appeared symmetric, no presence of discharge or flaring. For the mouth, the tongue of the patient is centrally positioned. The smooth palates are light pink and smooth, while the hard palates has a more irregular texture. For the neck, the patient showed coordinated, smooth head movement with no discomfort. Now let's proceed to our cardiovascular. For day 1 and day 2 pulse rate is 80 beats in a 1 whole minute. Blood pressure for day 1 is 130/80, and the patient is on bottle number 1, D5LR 1 liter at 120 cc per hour with a remaining solution of 500 cc. For day 2, blood pressure is 125/75 with a bottle number 4 plain NSS at 100 cc per hour with a remaining solution of 960 cc. For the day 3, pulse rate is 84 beats in a whole minute. Blood pressure is 130/80 in a bottle of number 7 plain NSS at 100 cc per hour with a remaining solution of 600 cc at left hand cephalic vein from day 1 to day 3. For the respiratory, day 1, we had 20 cycles per minute, day 2, 19 cycles per minute, and day 3, 22 cycles per minute. For the breast, all assessments were normal. There were no discharges coming out from the patient's nipples. Breast is smooth, soft, no visible nor palpable lumps. For the gastrointestinal, all assessments were normal. Skin color is uniform, no lesions, scars, and venous engorgement. Contour is flat. There were no abnormal sounds upon auscultation and absence of solid structures upon percussion and palpation. For the genitourinary, our patient is attached with a Foley catheter. The patient is monitored every 2 hours. For the first day, voids at 150 ml of urine. For the second day, voids at 130 ml of urine. And this was all in clear dark yellow color. For the day 3, the patient is no longer attached with a Foley catheter, and he freely voids 150 ml of urine every 2 hours, indicating optimal urine output. For our musculoskeletal, patient has multiple injuries, specifically on the femur, olecranon, and lateral malleolus, and was casted after the surgery. Redness, swelling, and abrasions are present. Redness, swelling, and abrasions are now lessened on the patient on day 2, and on the day 3, this was significantly reduced. For our neurologic, all assessments were normal. Patient is responsive and cooperative. Motor and sensory functions are all intact. For integumentary, upon inspection, the patient's injury site was red, swelling with abrasion on day 1, and on day 2, this was reduced. And for day 3, redness, swelling, and abrasions that was present in the past 2 days was significantly reduced.
Ano na galing assessment ni Sir Marco? Mayo kayo may progress sa yung living doc, no?
Tapos gali. He drove the motorcycle on approximately 110 kilometers per hour and collided with the truck. Plus, he had no protective gear, body gear, and then the fracturing. Fracturing his ankles, thigh, and arm as evidenced by the cephalocaldo assessment. The blood studies, CT scans, MRI, and X-ray results. which is why is now experiencing pain, redness, swelling, difficulty in movement, and multiple abrasions and deformities.
Anatomy of the skeletal system. The skeletal system includes all of the bones, cartilages, and ligaments of the body that support and give shape to the body and body structures. The skeleton consists of the bones of the body. The primary functions of the skeleton are to provide a rigid, internal structure that can support the weight of the body against the force of gravity, and to provide a structure upon which muscles can act to produce movements of the body. The exoskeleton, 80 bones, is formed by the vertebral column, which is 26, the rib cage, 12 pairs of ribs, and the sternum, and the skull, 22 bones, and 7 associated bones. The appendicular skeleton, 126 bones, is formed by the pectoral girdles, 4, the upper limb, 60, the pelvic girdle, 2, and the lower limb, 60. Femur, also called thigh bone, upper bone of the leg or hind leg. Olecranon process. It articulates behind the humerus in the olecranon fossa. The articular facet of the lateral malleolus, bony prominence on the lower fibula, forms the lateral border of the ankle joint. For the physiology, it supports. The primary functions of the skeletal system include movement, support, protection, production of blood cells, storage of minerals, and endocrine regulation. It also for protection. The skeletal system also helps our internal organs. Our cranium, skull, protects our brain and eyes. The ribs protect our heart and lungs and our vertebrae. Spine and backbones protect our spinal cord. Also, it is for movement. Bones provide the basic structure for muscles to attach themselves into so that our bodies are able to move. Tendons are tough and elastic bands that attach our muscles to that particular bone. Also for storage, the bone matrix of the skeletal system is mainly involved in storing or preserving different types of essential minerals, which are required to facilitate growth and repair the body cells and tissues. Also for regulation of endocrine glands, the bone cells present within the skeletal system plays an important role in releasing the synthesized hormones from the respective endocrine glands for the further required by the body for different metabolisms.
Actual nursing diagnosis. Acute pain related to multiple injuries and abrasions. Desired outcomes. After 8 hours of nursing interventions, the patient will be able to identify the characteristics of the pain he is experiencing and modify tension causing pain. For nursing interventions, perform a comprehensive assessment of pain. This is to determine the characteristics of pain, obtain baseline data, and recognize areas requiring care. Place client in a comfortable position. This promotes optimal patient comfort and reduces anxiety. And encourage to perform deep breathing exercises. For the evaluation, the patient identified pain as an 8 out of 10 located at the right elbow, right thigh, and left foot. Goal met. The patient verbalized, makabuli gid yan nurse ang sakto nga plaster kag paginhawa sa pag-agwanta ka sakit, salamat gid.
For the desired outcome. For long-term goals. After 3 days of nursing interventions, the patient will be able to 1. Relieve pain, 2. Establish pain management. For the nursing intervention, both dependent, 1 is to administer prescribed pain medication. 2, refer patient to a pain specialist if recommended by the doctor. For justification, first is to provide pain relief. 2, enable patient to receive specialized care in pain management. For the evaluation, patient verbalized nagjutay na ang sakit sa akong lawas, which is goal met. 2, patient was able to hire a pain specialist and received proper care for pain.
Health teaching plan. Medications. First, we have omeprazole. It treats gastroesophageal reflux disease or GERD. Next, we have cefazolin. It treats respiratory tract infections. And lastly, we have tramadol. It treats moderate to severe pain. And then in exercise, first we consult the physician first if we wish to exercise or do any activities, such as stretching exercises, range of motion exercises, occupational therapy, flexibility training, and strength training.
For the treatment, fracture management including close reduction or bone alignment through manipulation or traction, immobilization using a splint or cast, and rehabilitation such as physical therapy. Physical therapy to regain strength and normal function in the affected area. Hygiene. First, hand washing. Second, keep cast dry during bath using bidet after defecating and wear loose fitting clothes.
For the outpatient, if the cast gets wet, call your doctor. If ever itch is experienced, blow cool air through the top opening of the cast from a hair dryer or a fan. Do not scratch by sticking a pen or other object inside. Follow up for consultation, medication, and x-ray as advised by the doctor. For the diet and nutrition, take in and use calcium, another key nutrient for healthy bones. Good sources are chicken, fish such as sardines, bread, cabbage, okra, and oranges. Foods to avoid includes food high in sugar or salt, processed meat, alcohol, soda, and caffeine. It is best to abstain from alcohol while healing a broken bone.
To conclude our case study, let's move on to conclusions and recommendations. First, in this case study, the student nurses aim to improve healthcare outcomes by proper management and raise awareness of the risks to prevent further complications of the patient's condition, safety, consideration, avoidance of fatigue, and proper footwear. Next, patient education is essential in order to take care of himself independently. Next, student nurses in this study are particularly caregivers for the patient to help physical needs, prevent illness, and to treat his health conditions. Next, to stimulate adherence, compliance to nursing interventions, and physician's advice will promote healing and achieve optimal health quicker. And lastly, information gathered from this case study looks forward to aid individuals determined to seek education pertaining to multiple injuries secondary to vehicular accident. So here are the references and resources from our case study. So that's it. Have a good day and thank you so much for listening.
I'm going crazy. I'm going crazy. 무뎌져 버린 내 가슴이 뛰어. I'm going crazy. Yeah. 시간은 계속 흘러만 가고 기다리다 지쳐 그만 너